Thanks for tuning in to Conversations with Betty LaMarr, coming to you live from the Bluff City. Conversations is weekly wall-to-wall talk about all things Memphis and the Mid-South. Conversations with Betty include people just like you, living on the Bluff, doing what you do to uplift the city of Memphis. And now, your host, Betty LaMarr.
Hello, and thanks for watching and listening to the Eye on Memphis show. I'm your host, Betty LaMarr. For those of you that like to watch and listen, for your pleasure, we're streaming live on Facebook. And yes, we're standing up for physical fitness, right? And the topic of our show today is about, being fine and physically fit. Because a lot of people, I'm guilty sometimes. We feel like as long as we can wear a size 6'8" and we're fine, that we don't have to be fit. But we do. We need to be fit. So to convince you of this fact, I brought with me to the studio, or should I say I invited to the studio, AM360 Fitness. Yes, I have the pros with me. Miss Kristen Clark and Anthony Travis. We'll be right back, and we're talking again about physical fitness, why you need to put the fit with your fineness. Hello, and welcome back to Eye on Memphis. I'm your host, Betty LaMarr. Thanks for watching and listening to the show every week. And again, for those of you that like to watch and listen, for your pleasure, we are streaming live on Facebook. I have the pros with me today from AM360 Fitness.
Yay.
Because we're talking about, we're putting the fit with the fineness. It's just not about being fine, ladies and gentlemen. It is about being fit. And I am singing to the choir this morning because I know that I need to get back into my fitness game.
Stop.
Good morning, Kristen, Anthony. How are you?
Good morning.
Just
Thank
fine.
you for having us.
Of course, I had to have the best. So the best is AM360. So before we get started, I want each one of you to tell our viewers a little bit about yourself as it relates to our topic of discussion today, physical fitness. Kristen?
I am Kristen Clark. I am the fitness center supervisor at AM360. I also am a part of Anthony's extreme fitness classes. I have been at AM Diabetes and Endocrinology Center for almost 9 years. So I'm very excited to be a part of the fitness center that we've started.
Okay, perfect. Anthony?
Yeah, my name is Anthony Travis. You really gonna make me do this, Betty?
Yes, I am. And if you will,
yeah.
because we do have our Facebook followers,
Okay.
we want to make sure I know you all want to talk to me
okay.
because I'm just absolutely fabulous.
Of course.
Of
But
Yeah.
I
course.
want you all to also speak to our viewers.
Okay. My name is Anthony Travis. I'm the main guy at AM360. I've been doing fitness for 25 years now. I created Extreme Fitness, the class that everyone's talking about, and so that's about it.
Okay.
The monster
Right.
over extreme.
Okay, so let's talk about, we all know that AM Diabetes Center is comprehensive.
Right.
Which means that, you all are, what do we say, burning all cylinders here.
Mhm.
So how did the idea come about to incorporate the fitness center?
Well, from my perspective of it, I've been Dr. Kashif Latif's personal trainer for the last 6 or 7 years. And he's always talked about having this vision of getting fitness into the diabetes community. And so he was like, when I get this started, Anthony, you have to be here. We have to get this started with you. You have to start it. And so he told me his idea, his dream of what he wants to do, and we got together. And basically, is the problem with diabetes is when you go see a doctor and you first get diagnosed. By the way, I'm a type 1 diabetic, just so everybody knows.
Oh, I didn't know that.
Yeah, I'm a type 1 diabetic. So when I first got diagnosed, from personal experience, the doctor told me I was overweight, I needed to lose weight. Mind you, I'm a personal trainer, athletic, and I know I was no more than, 16% body fat. So I was fit. And he said, you need to start working out, and you need to talk to a nutritionist. Mind you, I'm a personal trainer. So that's what patients are getting from their doctors these days, or their endocrinologists in general. And he knew better. Dr. Kashif Latif knew better. He said, no, there has to be a nutrition plan. There has to be a physical plan. You just can't get anyone just to go to the gym and they have no idea what to do in a gym.
Oh, yeah.
And so we got a prescription for them. So now at AM Diabetes in 360, you have the nutrition and you have a personal trainer and a class or a plan to put you through the steps to where if you stay with us, that's fine. But even if you don't want to be a part of us, if you go to a gym, you know what to do.
Watch this space for more conversations with Betty LaMarr, and be sure to subscribe to Betty's YouTube channel, Betty LaMarr Memphis, to view more great shows. Now, back to Betty.
You have a plan. So it's basically a prescription for your fitness, you got a prescription for your nutrition, and there you go.
Okay, now, Kristen, I see you running around the center in your scrub, so that means you're on the clinical side as well. Why is it important for people living with diabetes to work out, to exercise? Because you all specialize in working with people that are living with diabetes.
Right.
Tell us the importance for people out there that are living with diabetes that think they don't really need to work out.
For some people, this can take them completely off of medications. Not for all diabetics. As Anthony said, he has type 1 diabetes, but for some people, they could simply follow this diet and exercise plan and it will help lower their blood sugar, and they can come off of medications from that. It's a structured program for these patients with diabetes to help lower their blood sugar levels. We monitor their blood sugar before and after class, sometimes during, depending on what their level is when they get there. So it's a great program.
Okay, so what is it basically, we're talking diabetes again. So what is it about diabetes, which we all need to work out, naturally. But what is it about diabetes, people living with diabetes, that is really very important for them? I know we lower the A1C. And what does that do when you lower the A1C? How does that make a person living with diabetes, how does that make their life better?
Thanks for tuning in to Conversations with Betty LaMarr, coming to you live from the Bluff City. Conversations is weekly wall-to-wall talk about all things Memphis and the Mid-South. Conversations with Betty include people just like you, living on the bluff, doing what you do to uplift the city of Memphis. And now, your host, Betty LaMarr.
It reduces your risk of complications. So your A1C is your average blood sugar for a period of 3 months.
Okay.
So that means your blood sugar has lower, which means your risk for complications has lowered as well.
Okay. So, all right, Anthony, we're going to talk a little bit because we're going to jump all over the place because I'm going to give you a good example when I think of AM360 Fitness.
Okay.
You remember this song, Tina Turner, Rolling on the River?
Why you doing the age thing? Why you doing the age thing? Yeah, of course I do.
Okay, yeah. We're Rolling on the River.
Of course I do, yeah.
Okay, so... Yeah, so when she started off, like, so we're going to say on this side, we do it slow, and we do it easy. So that's working with people with medical, like diabetes and other, that really need that slow and easy, but it's still effective.
I see where
and
you're
on
going.
The other side.
Right. We
do it rough.
Hardcore, rough, and rough.
Tell me this. Yeah, you do.
Right.
I've seen girls dragging look like tractor tires around the building. And I'm tired watching them. And I'm like, oh, my God. So let me ask you this. What kind of person, everybody's attracted to something. But what kind of a person would be attracted to dragging tires bigger than this room all over the place?
Honestly, I think it's a inner personality when it comes to working out that just per se, you see that with men all the time, but with females, you rarely see that rawness come out of them. And I think it's pushed back a little because they don't want to see, they have the idea that they think they're going to get too big or bulky and things like that. And that doesn't happen. The good thing about AM360 is it's 360 degrees of fitness.
Okay.
So the deal is if you're a type 1 diabetic or type 2 diabetic, just been diagnosed, we got that class for you where you are, the personal trainer is right there with you teaching the class. If you feel like you are about to pass out or you feel lightheaded, your blood sugar is low or high, someone's there to take care of business.
Okay, so that's the we're talking the
That's the beginning.
diabetes side.
Yeah, right. That's the beginning. And then if you want to graduate to a higher ranking class where, okay, you're ready to roll. Mind you, I'm a type 1 diabetic. So if you have type 1 diabetics that can work out just as hard doing CrossFit, they run marathons, they do the whole nine.
So
My class, that's what my class entails. For people that are like, okay, I need more. I need to, feel like I can push a tire, flip a tire, a 275-pound tire. I feel like I can do rope slams all day long. Meanwhile, you're getting yelled at. And a lot of it is a military mindset. So it's all in the mind.
I was in the military, but thankfully they didn't have us rolling around.
But what military was you? What branch were you in, though?
What branch?
Yeah.
Army.
There you go. See, I was a Marine.
There you go.
See, in the Marine Corps, we think a little differently.
Wait a
No, I'm
minute.
just joking. But these women want to be seen as physically fit,
Yes.
and they want to start. And the deal, if you're already there on the outside, it's like we said, need to get there on the inside. So you can look like you're fit and look like you can run a marathon all day, but can you actually run a marathon? And that's a no. And they want to feel that way on the inside. They want to be able to do it on the inside. That they
And
know they
once
can
you
do
start doing it,
Yeah.
it's an addiction.
Yeah,
Because it
Kristen
makes
takes
you
the
feel
class, yeah.
so good about yourself. I looked at his classes and thought that I could never do that. I could never be out there with those girls. And once you start, it's an addiction. And I was an avid person to go to the gym every morning at 3 o'clock in the morning. But once I started doing his classes, it's just something completely different. You have somebody standing there telling you what to do. So you're being told what to do. You're being held responsible. So it makes you feel better about yourself.
Well, I think that's my problem.
Well,
I don't want anybody to
Oh,
tell
come
me
on.
what to do.
You would get over it real quick.
I don't know.
Like
But
attracts like.
That's true. Okay, so what other services? And I'm asking this because I saw you doing a head, what you call it? A head standing on your head. What do you call it? A headstand.
Yeah.
So, okay, obviously you all do a lot of different things there. So let's talk about why you were standing on your head when I walked in the room. I said, that's a bad girl now.
Yes.
Because I'm not getting on the head.
So that's yoga. Yoga is so important to add into all of this because yoga helps strengthen, it helps with flexibility, it helps me with and everybody else, but this is a major thing for me. It helps with my mind as well. So it helps balance. It's key to be able to do all of the other things.
Okay, so to do yoga, because see, I'm 6'1", 6'5" in heels. So I'm not doing that pretzel thing, right? So
yes,
can you
could.
start?
Betty, come on.
No. So can you start at any point and still benefit from yoga?
We currently have 2 different instructors for our yoga.
Okay.
One of the classes is more of breathing. The other class is more
need that.
physical, I would
Yeah.
say.
More traditional.
So you can absolutely start at any level. Yeah. It's not all about doing headstands. It's more about learning how to breathe.
Mm-hmm.
So when did you start, you were a dancer too, correct?
Correct.
Okay, so when did you initially start yoga? But you're not like a big tall girl either.
Right. I'm 5'1". I'm
Okay.
very short.
So you're one of those girls that we're talking about.
6'1" in heels.
So
6'1" in heels.
Yeah,
I'm
so
on heels today. They make me a
you're
little
one of the
taller.
girls we're talking about today that is fine and fit. Yes, don't be modest.
What's up?
Cause that's what cause that's what we want people to know.
Right.
That, and I'm guilty of that. Because sometimes I'm in there throwing around dresses trying to find something that fit better. And I'm going to be honest with you. When I was living downtown on the river, I was very disciplined. It was very easy for me to jump up in the morning and walk. And then I started actually running around downtown. I was so, like you said, very proud of myself. Mm-hmm. And I would do it morning and evening. It was like, I don't care what else happened, I'm getting it in. When I moved more to the suburbs, I didn't have the river maybe to
The beautiful view.
the beautiful view and knowing there are people sort of around me to make me feel that somebody was watching me, because I've been through some stuff in my life that is important for me. I'm always, hyper vigilant about everything.
Right.
So I think that's what sort of took me out of my stride. But now with AM360 Fitness, I have no excuse, and you all are not very far from me. But speaking of that, being fit and fine, we're going to take a break, and we're going to come back. And again, my guest is AM360 Fitness, Kristen Clark, and Mr. Extreme Fitness himself that'll have you throwing up out in the grass, Anthony Travis.
Hi, I'm Angelica reporting live from LaMarr Productions in East Memphis. Thanks for watching Let's Talk with Betty LaMarr. Betty is renowned for her successful medical talk show, and now you're invited to watch the space for her new production, Let's Talk, which is laser focused on issues affecting young girls and women in the community. Now, back to Let's Talk with your host, Betty LaMarr.
Now, back to Betty with her guests, Kristen Clark and Anthony Travis with AM360 Fitness Center, specialized for people living with diabetes.
Welcome back. You're listening to IO Memphis, and I'm your host, Betty LaMarr. Would like to thank all of you out there that are watching and listening. My studio guest today is Kristen Clark and Anthony Travis with AM360 Fitness, 3025 K Bun Road in Bartlett. And as you know, when you see that AM, you know it is connected to AM Diabetes and Endocrinology Center. Before I go back to Anthony, because I'm all about this extreme fitness, I'm all about talking about it, okay? So let's talk about some of the other clinics that's at AM Diabetes. I know you all have Insulin Pump Center. Take us through AM Diabetes Center, because I know you know it inside out.
I do. So it's pretty much a one-stop shop. We have our insulin pump center, the only insulin pump center in the world. So it's a center that specializes for our patients that are on insulin pumps. We have a research department. We have other providers coming into our office so that our patients can see them at our office rather than having to go somewhere else. We have our diabetes education that we offer every Wednesday and one Saturday a month. We do in-house eye exams.
Everything, the
Everything.
The
Education
dietitians,
department,
right.
what
Yeah,
else?
education.
And now the fitness center.
And now the fitness center. I still have a feeling we're missing something. You have the front desk,
Yeah, the front desk.
great customer service, and that is for sure. And also, what a lot of people fail to realize, other than the word endocrine, but if you don't have an endocrine disorder, you don't know what endocrine is.
Right.
We have quite a few wonderful reviews on Yelp for your thyroid care.
Oh yeah, yeah, yeah.
So a lot of, does men and women both deal with thyroid issues?
Yes.
Okay, so your fitness center, even though it's for people with diabetes on the nice and easy, can anyone come there regardless of whether they're diabetic or not?
Yes, they do not have to be our patient. Anybody from the outside can come. Anybody can refer patients. You do not have to have diabetes to do the diabetes program. Anybody is welcome.
Okay, perfect. 'Cause that's really good to know. So it means I can come in there and, okay, let me ask you this. Okay, walk me through here, this Anthony. Okay.
Okay.
I come in through the door and I sign in.
Right.
And then what if I need a personal trainer or somebody to, because I need to start back at square one, because one thing about it, when you stop, you got to start over because your muscles and stuff now
Very
is
true.
like, oh, I haven't run like this in a while.
Yeah.
So tell me how that process is going to go down for somebody like me that's a little bit intimidated because I feel bad because I haven't, I didn't keep my regimen up like I should have.
Okay. First of all, it depends on, like you said, if you're not with the clinic.
Okay.
If you're not Dr. Latif's patient, you can just come in, and the deal is, you either talk to me or you talk to the guy at the front desk. This is JT.
Okay.
Which is awesome. Shout out
JT.
JT.
Love JT.
That's why we
Shout
love
out
JT.
to
Shout out to JT. That's my man. And we see what your goals are. Basically, if you've never taken a fitness class in general, or if you never had a personal trainer in general, the deal is I would rather, as a personal trainer, to take one of the classes first to see if you have problems that we don't know about because you didn't go through the clinical side of it.
Oh,
And just like patients lie to their doctors, clients lie to personal trainers. Oh, I had a back injury 20 years ago. No, it was last week you had the injury. So that's what we want to do first. And then we set you up a fitness assessment with me. And we do a basic fitness assessment where I test your bench press max. I test your cardiovascular, see how long. Oh yeah, because you have to do a certain amount of push-ups. We want to see if you can do some push-ups. But besides the inside, I want to see if you have injuries that you don't even realize you have, or you're so weak at a certain position where if we did something, the first time you did it, you'll immediately get an injury.
Okay, so what about if I have, one of my hindrances really with anybody messing with my body is my shoulders.
Okay.
I had surgery on one shoulder.
Right.
And I sleep on the other like a fetus. And honestly, I cannot sleep in any other position other than on my arm. So I wear that pad out. So I always think, or if I do a fitness class, then if I have to do things that my shoulder is involved in, what if I get hurt?
Exactly. And that's exactly what I was saying. The deal is you would probably have a muscle imbalance where one shoulder is way stronger than the other.
Oh, yeah.
And so when we do a certain exercise, like if we're doing sledgehammers.
What's a sledgehammer now?
So we're taking 16-pound sledgehammers and you hit your tire. So you go 20 right, 20 left. And you can probably do it all day with one side, but as soon as you try to do it with the other side,
no, about all day now.
what happens is you either pull a muscle or you tear it.
Oh.
And that's a problem. So you wanted to get into fitness, and all of a sudden, your first day, you can't work out for a whole year.
I'm at the VA.
And you're getting ready to have surgery. So that's why it's always good to set up a fitness assessment first with a personal trainer.
Okay.
Certified personal trainer. Set up a fitness assessment and go from there. I advise women. Most of the women that I train, they all get blood work done because it could be it's a woman thing. Thyroid issues and stuff like that. It's probably something with your thyroid that you didn't have no idea about. And all it was your lack of fitness, and you start working out, and all of a sudden everything changes. With some people, it's their lack of inactivity. In this day and age, everybody has their phones, they're sitting at home, their kids, they're playing the video games. No one's getting fit. No one's going outside. No one's playing anymore. And so it's just your lack of activity. It's not even that you're taking in too many calories or you're eating bad. It's just that your lack of activity, you're not doing anything. So if you're taking in 2,000 calories a day, per se, That's fine. What's wrong with 2,000 calories a day? Work out. If you work out and you're burning half those calories off, how many calories are you taking?
So if you're not
There you go.
working out, how many calories?
Well, that's an individual thing. That's an individual thing. So we're
I
all
eat
like
a salad
snowflakes.
every day, right?
We're all like snowflakes.
Because see, my blessing is that I'm sitting at a desk all day, be it editing videos, and that's not a good thing either.
Right.
And I don't do heat very well. I'm not sweating. I'm just being honest. I'm not sweating for any reason. The only time I remember sweating in my life, I had to go to the hospital in the ambulance because I was sweating. I knew something was really going on wrong. So
Betty,
that extreme
you
fitness.
would not sweat for
She's
me.
coming to a class. We're
You
going to
wouldn't
drag
sweat
her
for
in
me.
the class.
I will.
You wouldn't sweat for me. Are you saying you wouldn't sweat for me?
I wouldn't sweat for me
But
because
you
I
would
don't
sweat
like
for
it
me.
on my body.
But you would sweat for me. I mean, you'd come to my class and you'd sweat for me. You would do it for me.
If you promise not to, I'm not going to be going out there throwing up. Okay,
I'm a puppy dog. I got you.
Anthony.
You see the halo?
I've seen the girls dragging the tractor tires around.
You'll be fine.
And not only
I got
that, when they get through doing all of that, I'm thinking, okay, so I guess they're finished. And then a few minutes later, I see them coming around the block. I'm like, how in the... And then Kristen in the...
Yeah, exactly.
I'm like, I just go,
But
how are you all doing that? How long did it take you to get to that point where you could do... Because I would love to do it.
Mhm.
I don't know if I can do extreme, but I want to get back into
Right.
just getting my body really physically fit because it's important for your health.
right, it's
That's
very true.
number one. And then
True.
it does, your body looks good in a nice little hot pink dress.
Ah,
Okay, vanity.
yeah,
You
yeah.
girls have a lot of vanity going on. So let's go there. How
Mm-hmm.
long did it take you to get your body, or did it ever get out of shape? Have you ever been out of shape?
So in December, I ran the half marathon for St. Jude. Shortly after that, I had a surgery, and it put me down for 8 weeks. I tried to get back into running, and like you said, once you get out of something, it is so hard to get back into it. And I struggled with that. I started going back to the gym some, but what really helped me is yoga.
Really?
Helped me get back to where I needed to be. And then I just kind of started fresh with Anthony's class. I was very nervous looking at the women who were already in the class. And the thing about it is everybody encourages each other.
Yeah. Like
That's
attracts
what I
like.
love about that class.
Really?
Every single
yeah.
person in there helps you do better. Everybody motivates each other. It's amazing.
Well, what you got to understand is like with the class, like attracts like. So, for instance, just per se, I had an athlete that just left for college, and she's a volleyball star. She's awesome, but yet she's recovering from a knee injury that she had. We went her through. She started taking the classes.
Okay.
And you got to understand that she's dealing with women in my class are upper age, so they're in their 30s, 40s. We got some 50-year-olds.
Oh, that's-
Hold on, average is 30?
No, yeah, they're in their
Wait a
30s,
minute.
40s, but she's
Where
six,
is my
but
piano?
she's
I
17.
left it at home. You
She's 17 and 18, so but she made a point to text me and let these girls know, these women know that they are awesome. That
Oh,
her
that's so
volleyball
sweet.
practices and everything is so easy compared to, the class that she take because of them. So
Oh.
yeah, age isn't a number. It has nothing to do with that. You're gonna fit in. You'll find your niche, and then everybody pushes each other.
And there is people of all ages.
yeah.
So those, what do you call those things?
Rope slams. Yeah.
So the rope slams,
battle
how
ropes.
would that affect somebody with shoulder?
See, being that I know you have a shoulder injury, so the deal is with you would not do the rope slams where we do two-handed. So there's no excuses.
So, but I need to go through the slow and easy before I graduate to the rough.
Thanks for listening to Conversations with Betty LaMarr. Subscribe to our YouTube channel, Betty LaMarr Memphis. We'll talk to you next week on Conversations with Betty LaMarr.